Good morning, everyone. So as Tim mentioned, I'll be discussing about the role of family in psychological distress in Indian women with breast cancer. And this is from my PhD. So a bit of overview of the session. I'll go on the background of my PhD, a background of the topic, discuss the research questions, the findings, the conclusion, and clinical implications. So as Tim mentioned, I did my PhD while I was in India. I was doing an out-of-program training in Kerala, which is a state from where I was from, during my specialist training in palliative medicine, and then realized that, one, there is a lack of research among breast cancer patients. So I was working jointly with the oncology department and found that there was lots of patients coming for treatment, and there was an unaddressed need among the psychological symptoms, and there was a lack of research from India. And that's when I decided to contact Miriam, whom I knew previously while working in Yorkshire. And then we thought of doing a project, which was initially registered as an MD with Hull York Medical School. And initially I was just thinking of maybe doing a literature review and probably a qualitative interview study. But then when I went on to do it, the project developed, and then we thought that we'll complete the whole thing. So do a literature review specifically for Indian patients, not the whole Asian, but looking just for the Indian patients, Indian studies, then the interview study, and then also do some focus group discussion. So we went on to do interview some doctors, it is oncologists working in the hospital where I was working, the nurses who work with cancer patients, specifically breast cancer patients. Then I went to my church and got a group of members of the church, and then talked about the psychological symptoms of breast cancer patient. And we had lots of volunteers in Kerala in palliative medicine. So and I also got to them. So I had 5 groups, focus groups, and then we have the interview study. And then Miriam said, okay, why not make it a PhD? So I converted that into a PhD, and all this was done as a part-time while I was there. Again, it's an example of how you can do things by distance before COVID. So all my sort of supervision with Miriam was through Skype at that time, all before COVID. And I did come to UK to complete my credits for some courses with Hull York Medical School. And then when I completed PhD, I decided to come back to UK to work. And so here I am presenting on the results. And you can find these in 3 publications. So the literature review has come in BMJ Supportive and Palliative Care. And as I mentioned, this is specifically looking for Indian papers, which is quite interesting because when I went to the PubMed search, there's lots of studies I couldn't get from them. So because I was working in the hospital in Kochi, she was able to get some local studies published in India. So that also I included in this literature review. Another interesting fact was because I was looking just for Indian population, outside India there wasn't much study. So I got 4 papers from Canada, and 3 of them were qualitative and 1 was observational study. And the rest of the observational study were from India, and only 2 qualitative study was from India. So there was definitely a lack of qualitative research coming from India. Then I also published the interview studies in supportive care and cancer, and the focus group studies also come in supportive care and cancer. So if you want to read the full research, it's all available. So a bit of background. Breast cancer is, like globally, it's the most common cancer in India, also women in India. And the other important factor is that, just like Joseph mentioned, the mortality. So you can see that because of the lack of organized cancer screening program, unfortunately, breast cancer, when it reaches the oncologist, is usually in the metastatic stage. So mortality with breast cancer is also quite high. We do have lots of treatment availability. We do have the latest research and treatment, but unfortunately, the patients reach the oncologist quite late because of the screening program. And that's the other reason where palliative care is so important, because most of the patients come in metastatic state of breast cancer, and then we all know that metastatic cancer, palliative care should be involved, but that's not happening, as when you listen to Joseph would have realized that. And psychological symptoms are common. It's common in Western population. It's not as indifferent in Indian also. Bit of background about India. The 7th largest country in the world, very large democracy. Now the most populous country in the world as of this year. We've overtaken China. This map is not accurate, and right now Jammu and Kashmir it's not a state anymore. Last year it's been separated to 2 union territories. So as of now, we've got 28 states and 8 union territories. And as you can see, religion is so important for us because India was the birthplace of 4 important religions: Hinduism, Jainism, Sikhism, and Buddhism. And another important thing about India is the family structure. For traditionally, it was a joint family system. It continues to live with a joint family system. So we tend to live with our father, our grandparents, maybe extended family, uncles, aunt, and it's a backbone of the country, joint family. But now in some urban areas, they are moving to nuclear families, but then usually it's still a joint family system. Now, I think to understand the culture of Indian women, it's important to understand history. So I went a bit more into the history of family system. And you can see the history of India starts from Indus Valley civilization as early as 7000 BC. There are descriptions about the family, the culture there, and the important findings from sculptures and figurines at that time show that women were held in high position. So women were given divine power. They were treated as high position because the sculptures used to show that. But women, there was actually a division of labor, but women were still doing like grinding of grain and doing manual work and all those things, and also in the kitchen. So that was the earliest evidence of the culture of women in India. Then next came the 2nd century BC, when there was an important book that was written. So I don't know whether you must have heard. It's called Laws of Manu, Manusmriti, where again the patriarchal structure of the country came during the Laws of Manu. There were some restrictions which was imposed among the women. The patriarchy came in. Women were thought to be submissive to husbands, to the brothers, to the son. There was restrictions on widow remarriage. There was increase in the gap between men and women when they're marrying, and all those restrictions came in. And women was asked to stay in the family, look after the in-laws, look after their husbands. Were not allowed to go out such jobs. All this came during the 2nd century BC. And sometimes, how the country is changing now, Laws of Manu still appears to be in conversation. Recently, there was a Supreme Court also mentioned Laws of Manu when it was delivering one of the verdicts. So that is why it is still the patriarchal nature, and the patriarchal society still continues there, unfortunately, after all these years. So then it went on to, but another important fact is that the Laws of Manu was not very evident in the South India, or Kerala, where the research was done, because Laws of Manu was mostly in the states where Sanskrit was a common language, and in South India that wasn't the case. So in Kerala there was a matrilineal descent where the family property actually passed from the mother to the child, and the men didn't get much of the property. That was in Kerala. Then we came to Buddhist age, where the status of women improved a bit. Women were admitted monasteries, and the adoption of women was made legal. So Buddhists gave a bit more importance to the position of women. Then came Islam and the Mughals to India. So we can see that the Parda system came to India at that time. And even when the Muslim women were using the Parda system, the Hindu women were also trying to veil their women using, because they want to sort of hide them from the Muslim men. So the Parda system and using veils on the head came during that time. And then the Britishers came. So there was actually an improvement in the status of women to the British time, and the women were given a position according to their development, so the joint family system was still there, and it was also part of the religion, because there was families where they lived together. There were religious gods were there, so each family had a temple where they worshipped together. So there was different gods. So that was all part of the system. And sometimes, if you can see some of the business people and the rich people in the country also follow a joint family system, because instead of Tata and all the business all went in the same family. So they made sure that was also the reason for the economic development of the country. So the family was quite important, and is still important. So my 2 research questions were, I wanted to find out what are the psychological concerns of women of Indian heritage living anywhere in the world. And why did I go for living anywhere in the world is because you might know India is the Indian immigrants are the largest diaspora in the world. So wherever you go, you probably will find an Indian. And especially there is a saying back in the state of Kerala, if you go to Moon, there'll be a person from Kerala having a tea shop there. So that's what we talk about, from Kerala, because Kerala people go to to Middle East, they go to US, Canada, then now it's all coming to UK now. We've got, the York Hospital doing an international recruitment directly from Kochi, and lots of nurses have joined. So Indians are everywhere. So it's important to understand the psychological concerns of Indian women. Is it different from the other population? And then what are the influences which aggravate or influence the psychological concerns arising from this Indian women? And as I mentioned, there was a literature review, there's an interview study, and focus group discussion. There was about 763 papers in total, and I found 18 of them, and which was 13 was observational, I mentioned, and 5 was qualitative. And the only data outside India I got was from Canada, which is mostly Sikh, Punjab, Sikh immigrants going to Canada. I interviewed 20 patients with breast cancer in my hospital, and the focus group discussion included 45 participants, which was doctors, nurses, members of church, and volunteers. So when I talk about the family, the answer came from the second question: what was the what were the influences which aggravate or ameliorated the psychological concerns? And among that, there was lots were there. There was religion was important, the community was important, but we are just concentrating on the role of family. And to describe my findings from the role of family, I'll be using representative quotes, and I've also divided that into 4 themes just on the basis of the role of family. So. First, the family was considered as a source of support. So how did women find family? Mostly they were considered a source of support. So you can see that this was from the literature review, the quote about the women telling heroic stories of the family members. They are quitting their jobs, coming with them to appointments, and taking out the household duties, providing all the physical care. So the family refusing to let her talk about the things, think about things of breast cancer, because that can make her more depressed. So encourage them to stay active, and encourage them to be there, and also providing the support for them to come for all the treatments. This is from the interview study. So the support I have at home, it's for my children. They are the greatest thing, and they do not make me do any of these things. You don't have to know about this. You just have to sit and listen, and don't worry about money at all. So that is also another one, because the place that I interviewed was a private hospital, and the treatment was not free. So, but the family, the men, the children were spending their money to look after their mother. There's an instance where your extended family member, the sister-in-law, came over from Middle East to look after me, because they didn't have anybody else to come with me for treatment, for appointments. So it's extended family that comes in, and sometimes the husband also supports. So generally there was a feeling of a positive thing from the family, how they provided the support, but also it was also a source of distress. So there were some instances where actually family itself was causing a source of distress. For example, there were some instances, again, in the literature review, that the women were thinking there are some already existing problems in the family, and then when the breast cancer came, they were thinking about divorce because of lack of support from the husband, during the time of an illness, when they're supposed to be supporting them, unfortunately was not supporting, and that probably ended up in divorce. And sometimes the family members took it hard because, especially children, the body image issues, when they lose a hair, loss of breast, the children were not able to accept that, and they cried. They were not able to look at the other mother. They were not able to go to school, and because the distress of the family was increased, naturally that will increase the distress of the patient. So that was one reason. Then you mentioned joint family system, but then towards cities it is coming to nuclear family system. So when nuclear family system happens, so the problem with that is what the husband should be there to look after, but if the husband is not able to do that, if he's not able to take time maybe from work because he has to work, then that created this distress. So you think that, or women tend to think that it's because they don't care for you, but actually the husband probably should work, but that again aggravated the distress, and that also made that they were finding it difficult to cope. And sometimes, again, we need to talk about things, isn't it? These women found it difficult. They didn't have right person to talk to. So, sometimes the families behave as if, okay, I've got to the treatment. Now this is a part of life. All these symptoms are part of life. You just get on with your life. And the family goes off to work. And these women sit at home and thinking about the future, having nobody to talk to. And that again aggravates the distress. The other important thing was the stigma related to the breast cancer. So as I mentioned regarding the history, the loss of Manu, so the marriage was very important, and usually it's arranged marriage. After marriage, the next important thing is childbirth. So usually within 1 year of marriage, we all get the question, is there any news to tell me? Are you pregnant? That is a common question we experience back home immediately after a year of marriage. So the treatments of breast cancer will affect the fertility. So that stigma is there. So you know that the stigma of marriage for the children. So everybody knows that obviously cancer, the C word, probably there's genetics involved. So if I get breast cancer, will my daughter be married off? So that is the main concern. So they don't want anybody to know about it. And another one was about the patient was whether the husband would abandon her because the mastectomy was done. My body image issue. So the main problem with her is because I'm not beautiful anymore, will my husband abandon me? So all those are connected to the family that is causing them the distress. And now showing love and showing affection. This interesting quote came from one of the doctors in the focus group study, and they were telling, probably in the Western countries, it's much more easier to show your affection, show your love. I don't get up in the morning and tell my wife I love you, because that's not how it's done in the country. And so obviously the men who go out to work still do care for the wife, but they don't know how to show it, and there's not a culture of showing it. Maybe that is one of the reasons that women felt that. Maybe it's not needed all the time, but when you're ill, you need somebody to show you support, and that probably was lacking in the culture. Now, third is how the role of women got affected, in the family got affected because of breast cancer. And for that, as I mentioned before, the women were worried that they won't be able to conceive anymore. So if the breast cancer came in quite in the early stage, before they had completed the family, they worried that if I go on with the treatment, is that going to affect my fertility? Will I be able to conceive? So that affected, and that probably led to a non-adherence of treatment. Then the women still had to do all the work, so the chores or the household work. Sometimes the women still had to do. So because of the cancer, because of the treatment, it affected their activities, and they were not able to do the household work, and that caused us stress. So their role in the family has changed, and how will I fulfill my role as a wife, my duties as a wife? And this quote, interesting quote, came from one of the volunteers. So whenever a woman becomes ill, the total structure of the family is affected. They can't do anything. The kids' studies will be affected. The husband's work is affected. Husband is not able to go to work. So income of the family is affected. So total structure of the family gets changed. So the women are considered as the backbone of the family. They keep the family together. So then when a woman is affected, then that is lost, isn't it? And another interesting quote again from Kerala, and this actually caused a bit of laughter in the room when they said that, the husbands are often lazy. The women who get up in the morning, right in the morning, they start cooking, getting kids ready for the school, looking after the husband, and then right from getting the shirt ironed, ready to wear, feeding them, and getting their bags ready, and giving it to them so they can go for working. And I'm not exaggerating; this is true. So imagine, you'll all be looking at our Indian men differently. But so imagine, if a woman is affected, then how does it affect the structure of the family? So they are the backbone of, maintaining the family. And finally, decision-making. What was the role of family? Again, my previous speaker touched on this point, on how family influences decision-making. And it is true. It's true in India also, in our culture also. So you can see that this was from the literature review, where she described herself as uneducated. And she was told that, she was not told that the entire breast is going to be removed. They must have told my daughter something in English, but I didn't know anything about that. So isn't this, the clinicians probably would find this familiar in this country also. When you don't have an interpreter, and you should get an interpreter, but sometimes you don't, and the family asks an interpreter. How much does the family tell the patient? We don't know, so because we don't know the language. So it looks like, she didn't even know she had a mastectomy. It was only conveyed to the family member. And again, another one is about, they recall not fully understanding about the treatment. Even when translators were available, physicians only gave full explanation to the family members. And me working as a clinician also appreciates, sometimes it's very difficult to get the right interpreter, and sometimes we just choose the easy way out, but we don't know how much the family is conveying to them, and the women want to know. And this is actually from a study in India, where you don't need an interpreter, but unfortunately, the decision for a breast reconstruction was only discussed with the husband when she was in the surgery. So she was in the theater, she was having the surgery, and then the surgeon came outside, talked to the husband, made a decision to go ahead with the reconstruction. But then subsequently, she has felt that was not needed. Maybe she didn't like it and she didn't want it, but she feels that she was not involved in the decision making. And this happened in the country where language is not an issue. So that is the patriarchal structure, isn't it? Because the husband didn't feel that he has to ask the wife the important question. He just made a decision because he felt that was the right thing to do. And that's a culture there which we need to understand. So to conclude, this cancer affects the woman's primary role in the family. So they feel that they don't have any more job in the family. They feel that the job is affected. Being a mother, being the wife, that has been affected. And the family can be a two-edged sword. So it can be a source of great support, but also a source of distress in situations. And women are worried about the domestic chores, how they're helping the extended family. The important thing we need to remember is that treatment decisions are being taken by the extended family, and we need to address that, especially as in our country, in the country here. Fertility and childbirth is affected. Women worry about that. They don't want to go for treatment, mainly if they think that fertility is going to be affected. So that needs to be addressed. And women has to be involved in decision making. And the cultural differences are there. And cultural differences of showing the love, how it's being done there, how it's different here, all needs to be appreciated. So what are the clinical implications for us as clinicians? Just like any other, probably it's more in probably Asian culture, the family-centered approach to care is so important. So you might not have the patient coming alone. The patient would have the family with them and would prefer it that way because that's how the things are done back home. So it's a culturally congruent care that we try to provide. And motherhood and parenting should be kept in mind for young breast cancer patients. The issues of the patient should be understood in the context of the societal attitude of the woman as a wife, as a mother, and the care of older in-laws. And when we provide care, we should aim to provide a culturally congruent care that is acceptable to our patients. Thank you very much for listening. Any questions?
I don't think we've got any questions. Okay. Sorry. I was going to say, I don't think we've got any questions online.
Okay.
Thank you, Sunitha. That was really interesting. We recently conducted a review of the experiences of informal carers in sub-Saharan Africa, and some of the findings were touched on very similar themes to what you were just talking about. Your study had the patient at the centre, but I wonder what you thought your next steps might be in terms of understanding the experiences of the lazy husbands, who sometimes we have found we found issues related to gender, particularly gender-related cancers and difficulties caring for a loved one with diagnoses like breast cancer or prostate cancer and difficulties caring for a family member. I wonder if you could reflect on experiences of carers, experiences of the lazy husband or otherwise, and what you might like to do next in terms of researching that.
Thanks, Joseph. Yeah, so it's interesting. So I think, we can't label them as lazy husbands. I mean, obviously, that's what the code said. But I think it's the way of, them not showing the emotion. So, but once if it's a nuclear family, they tend to get involved, and they are the only ones looking after. But they'll have to look after the work also. So they tend to get involved and they do care for. But sometimes it's got distress. Yeah. The next steps probably would be, I was thinking was maybe I should get a data from UK as regards to particularly Indian population, whether more studies can be done here. Because what I believe and what my research showed was that culture do travel. So how does this affect when we move from a developing country to developed country? How does that change? And the extended family is probably not here. So if that is not here, how does the support system work? So maybe mirroring a similar study here.
Thank you.
Hello. Hello, I'm Sonia. Thank you very much. Really interesting talk. I wondered if you interviewed any unmarried women as compared to married women, and whether there are any differences in the themes found.
No, in the 20 women that I interviewed, they were all married, and Yeah, obviously, so I couldn't find a difference. And then, again, one of those things that probably is a taboo back home is, women wouldn't openly say. So you wouldn't have a kid outside marriage. It happens now, but it's not that common, and it probably is a taboo subject. So in the interview, the patients that I had was mostly all married women. Yeah, all of them were. Yeah.
Thank you.